The L5-S1 area of the spine is the most common area of the spine to hurt and cause debilitation for people. Let's cover in this video some activities that it's important to avoid if you are suffering from L5-S1 pain. First of all, to recap, L5-S1 pain is right in the bottom of your back through here. That's the area we're talking about. But that pain will often spread, and it will spread from here commonly into the buttock and down into the thigh, the leg, even into the foot. So that L5-S1 area, which is the most common area of the spine to cause people problems, it's often coming about because the facet joints, or the joints in through the back of the spine here, get compressed and jammed and don't move properly, which aggravates the central nervous system. It also can come about when the disc or the cushioner gets bulged or inflamed, protrudes, or in the most serious cases, prolapses. That's less common, thankfully, than the other problem, which is when the joints and the facet joints just jam up. But either way, there are some common things to avoid when you're going through a phase of this. So the first thing to avoid is heavy bending and lifting, or heavy lifting if you like. So anything that's going to require you to bend and lift is going to place extra stress and strain through that area. I know it seems like common sense, but it's important to mention. So get that out of your lifestyle if you're suffering. So no heavy lifting. The other thing is high impact activities, such as running, jumping, contact sport. The things that are going to create a jarring motion through your body where you're impacting with earth, and you're impacting in a way that creates forces up through your foot, knee, hip, into the lower back, and creating a further compression through that area. So we want to avoid impact type activities. So it's heavy lifting, impact. The third thing we want to do is avoid sitting for prolonged periods of time. So sitting increases the pressure through the disc and increases the compression through the joints. I would recommend that if you're in a lot of pain through that area, or if you have the syndrome of pain spreading from that area into the legs, that the maximum amount of time that you sit for is half an hour before getting up and moving around. So the three things thus far: no heavy lifting, no high impact activities, no prolonged sitting. The third thing is to avoid rotation. So you want to be avoiding things that involve a lot of rotation. Sports such as tennis, sports such as golf, home activities such as ironing, such as sweeping, such as vacuuming, such as garden work. Get those out for the time being to let the body have a period of time to heal from this. Then the final thing to think of is posture. We want to make sure we don't round out our back. We don't want to flatten out our back. We want to keep an arc through our lower back. We want to have a degree of uprightness as best you possibly can through that area, because that's going to place the area and the physical structures in the best possible alignment to allow the body to spontaneously or over time create a healing environment. So it's really important that you follow those tips when you're going through a peak period of aggravation through those areas. Following those things to avoid is equally as important as implementing things that you should be doing to assist yourself. With all healing, there's an element of cut some things out, add some things in. And today's video is really just about the things to cut out if we're really dealing with that L5-S1 joint or disc aggravation. The tips and things to avoid. I hope this has been of some use to you. I hope you're not suffering with lower back pain, but you're watching this just because you're inquisitive. But if you are suffering, take on board these tips and get started on the road to recovery, because I have faith that the body can heal. I've seen it happen many times. There's no reason why yours can't as well. Any questions that you may have, please reach out, put them into the comments, and I'll be able to answer as best I can and hopefully provide further advice if necessary. Thanks again for watching. Cheers.